Hi, I'm Brad Mayfield. I'm the surgeon and chief medical officer at Chicot Memorial Medical Center in Lake Village, Arkansas. March is Colon Cancer Awareness Month, and I wanted to spend a few minutes just talking about the topic in general and some of the services we offer with regard to evaluation and treatment. The best way to detect cancer at an early stage is with screening, and screening means we're going to use some of the tools at our disposal to evaluate every patient, even if they're having no symptoms whatsoever. The most tried and true method is something that we offer right here at Chicot Memorial Medical Center, and that's called colonoscopy. That is an outpatient procedure where we inspect the inside of the colon and rectum. This is done under proper sedation and in a monitored setting, so it is safe and not only effective, but it can be done without leaving the area. One other advantage colonoscopy offers is that it can actually help prevent cancer. Colon cancer begins as a small polyp. It's not cancerous at that stage, but if it's left in place long enough, it can eventually turn into cancer down the road. With colonoscopy, we have the ability to remove most polyps and thereby preventing a cancer from occurring down the road. So in comparison to other screening methods, colonoscopy has the advantage of actually preventing the cancer. With colonoscopy as a screening test, how often should it be done? For an average risk individual, it should be done once every 10 years, beginning at age 45. This is a change from previous recommendations where we started at age 50. A few years ago, the recommendations changed to begin at age 45 because an increase in the incidence of colon cancer was being noted in patients under 50. So again, for an average risk individual, first colonoscopy or first screening in general should begin at 45 years old. For increased risk individuals, and by increased risk, I mean people who have a previous history of colon polyps or have a family history of a primary relative having colon cancer, those screenings should be done a little more frequently and should start a little earlier. Another important point, other screening methods besides colonoscopy are not indicated for people who are at increased risk. Those patients should all have colonoscopy as their screening method of choice. I hope this has been helpful as far as explaining a little bit about colon cancer and the screening measures that we have, as well as prevention. Again, colon cancer is one of the more preventable cancers, and we have tools available to help with this right here at Chicot Memorial Medical Center. Thank you.